Every 40 seconds, someone in the United States has a heart attack. That is over 800,000 people every single year, and almost every one of them believe the same myth you probably believe right now. The myth looks like this. A man grabs his chest, his face twists, he drops to the floor. That is what television taught you a heart attack looks like. Sudden, dramatic, no warning. In reality, the majority of heart attacks are not sudden at all. A heart attack is the final step of a process that has been building inside your arteries for years, sometimes decades. And in most cases, the body sends very specific distress signals in the 48 hours before the event, not vague feelings. Specific, recognizable physical warnings. The problem is not that your body stays silent. Your body practically shouts. The problem is that nobody ever taught you what those signals look like, so when they arrive, you explain them away. You blame them on stress, on a bad night of sleep, on something you ate, and then the 48 hours pass and the window closes. That is what this video is about. I am going to walk you through exactly what your body does in the days and hours before a heart attack, what each warning sign feels like, and what is actually happening inside your cardiovascular system when it appears. This is not meant to frighten you. It is meant to prepare you, because if something is predictable, it is at least partly preventable. And heart attacks, despite what you have been told, are among the most predictable medical emergencies that exist. Before I walk you through the warning signs, I need you to understand what is physically happening inside your heart. Because once you see the mechanism, every warning sign I describe later will make immediate intuitive sense. Your heart has its own private set of blood vessels called the coronary arteries. These are the fuel lines that feed the heart muscle itself. They wrap around the outside of the heart and deliver the oxygen and nutrients it needs to keep beating. Without them, the heart starves. Over years, a fatty substance called plaque builds up on the inner walls of those arteries, silently, no pain, no symptoms. The opening gets narrower and narrower, and you feel nothing. Then one of two things happens. Either the narrowing becomes so severe that blood flow drops below what the heart muscle needs to survive, or, more commonly, a patch of that plaque cracks open. The moment it ruptures, your blood treats that crack like an open wound. A clot forms on top of it within minutes, and the artery seals shut completely. Think of a water pipe that has been rusting from the inside for 20 years. The water still flows, just slower. Then one day, the rust patch cracks, debris piles up at the crack, and the pipe blocks. No more water. When that happens in your heart, muscle tissue begins dying within roughly 20 minutes. After about 6 hours, the damage is usually permanent and irreversible. That is why the 48-hour window before a heart attack matters so much. That is the window where the pipe is cracking but has not yet sealed. Your body knows it, and it tries to tell you. The first warning sign is not pain. It is exhaustion, but not the kind you recognize. This is not the tiredness you feel after a long day or a poor night of sleep. This is a deep, heavy, bone-level fatigue that arrives without any explanation. You slept 8 hours, and you wake up feeling like you ran a marathon in your sleep. You sit down to eat breakfast, and the effort of lifting a fork feels unreasonable. You have not done anything yet, and your body is already finished. Here is what is happening inside you. When a coronary artery is critically narrowed, your heart has to work significantly harder to push blood through that tight opening. It is running at near maximum effort just to maintain baseline circulation. Your body recognizes this and starts triaging. It diverts energy away from systems it considers non-essential, your skeletal muscles, your alertness, your motivation, and redirects everything toward keeping the heart supplied. You feel that diversion as crushing, inexplicable fatigue. This is not laziness. This is not aging. This is your body rationing its last reserves because the engine is failing. What makes this warning sign so dangerous is that it is the one people dismiss most easily. Stress, bad sleep, getting older. Those are the explanations people reach for, especially women. Clinical data consistently shows that unexplained fatigue is one of the most common pre-heart attack symptoms in women and one of the most frequently missed. The distinguishing feature is the timeline. This fatigue does not creep in over months. It lands on you over a day or two, with no change in your activity, your sleep, or your routine, and rest does not fix it. You can sleep 10 hours and wake up just as drained. That pattern is not normal. That pattern is a signal. The second warning sign is the one most people have heard of, but almost everyone misunderstands. When people think of heart-related chest pain, they picture a sharp, stabbing sensation. In reality, what patients describe is almost never sharp. It is pressure, tightness, a squeezing sensation in the center of the chest, as if someone sat down on your rib cage or a belt is being slowly tightened around your torso. Some people say it feels like a weight they cannot lift off. Here is the critical detail. In the 48-hour warning phase, this pressure comes and goes. It might appear during a short walk and fade the moment you sit down. It might wake you at 3 in the morning and vanish by the time you are fully awake. Because it leaves, you convince yourself it was indigestion, gas, a pulled muscle. You move on. What is actually happening has a name: unstable angina. The plaque inside your coronary artery has narrowed the opening enough that during moments of even mild exertion or stress, blood flow cannot keep up with what the heart muscle demands. The heart briefly starves, sends a pain signal, and then the demand drops and the pain fades. That cycle of pain appearing and disappearing is not your body recovering. It is your body warning you that the plaque is fragile and could rupture at any moment. One thing worth knowing: angina typically worsens with effort and improves with rest. Heartburn and acid reflux tend to worsen when you lie down and usually carry a burning quality rather than a squeezing one. But do not try to diagnose this distinction yourself. If chest pressure is new, if it keeps returning, and if it connects to physical effort, that is a reason to get evaluated urgently, not a reason to wait and see. The third warning sign is the one that catches people completely off guard: pain that shows up nowhere near your chest. It can appear in your jaw, feeling exactly like a deep toothache, except no dentist can find a problem. It can settle between your shoulder blades, a heavy ache in the upper back that arrives during exertion and fades when you stop. It can run down your left arm, sometimes both arms, a dull pressure that has nothing to do with how you slept or what you lifted. Some people feel it in the upper abdomen and spend days convinced they have a stomach problem. The reason your heart can produce pain in your jaw or your arm has to do with how your nervous system is wired. Your heart does not have its own dedicated pain highway to the brain. It shares nerve pathways through the spinal cord with your jaw, your shoulders, your arms, and your upper back. When the heart is in distress, pain signals flood into those shared channels, and the brain misreads the source. It interprets the signal as coming from the arm or the jaw instead of from the heart. Doctors call this referred pain. This is why people walk into emergency rooms convinced they have a dental infection or a shoulder injury and walk out with a cardiac diagnosis. The pain was real, the location was misleading. Here is what I want you to hold on to. Any one of these referred pain locations appearing suddenly without an obvious cause is worth paying attention to. But if it arrives alongside the fatigue from Chapter 3 or the chest pressure from Chapter 4, the picture becomes very clear. Your body is not sending isolated signals anymore. It is sending a pattern, and patterns are what save lives when people recognize them in time. You have now learned 3 of the most important warning signals your body sends before a heart attack. 3 signals that the majority of people either miss entirely or explain away until the window closes. So the question becomes, what do you actually do with this information? I will tell you what most people do. They watch the video, they feel concerned for a few minutes, and they go back to their day without changing a single thing. The knowledge sits there unused, and unused knowledge does not protect anyone. But you have an option right now that most people do not know about. Care Health is a free platform that connects you with cardiac screenings, blood pressure monitoring programs, and clinical trials for heart disease in your area. You fill in a short form, your date of birth, your gender, whether you have children under 18. It takes about 30 seconds, and Care Health matches you with relevant health options near you. No cost, no commitment, no insurance questions. The link is in the description below this video, or you can scan the QR code on your screen right now. Just point your phone camera at it. I tell every patient the same thing. Information without action is just anxiety. You now have the information. This is the action step. 30 seconds to find out what screenings and options are available to you in your area for free. Now back to what you need to know. Because there are more warning signs your body sends in that 48-hour window, and the ones that come next are the signals almost nobody recognizes. The 4th warning sign hits you in a place you would not expect. Your lungs. You walk from the living room to the kitchen and you are winded. You climb half a flight of stairs and you have to stop, hands on your knees, waiting for your breath to come back. You have walked this route 1,000 times. Nothing changed. Except now, it feels like you just sprinted. This is not being out of shape. This is not poor fitness catching up with you. Here is what is actually happening. When a coronary artery is severely compromised, your heart cannot pump blood forward efficiently. It is struggling just to keep itself alive, and it does not have the power to push blood through the lungs at the rate your body needs. Blood begins to back up. Fluid seeps out of the backed up blood vessels and into the lung tissue itself. Your lungs become slightly waterlogged. Their ability to exchange oxygen drops, and your body perceives that as breathlessness, even from minimal effort. There is a specific version of this that is a major clinical red flag. You lie down flat at night and suddenly feel like you cannot get enough air. You find yourself stacking 2 or 3 pillows just to breathe comfortably. Doctors call this orthopnea, and it happens because lying flat allows even more fluid to pool in the lungs. If you have gone from sleeping flat your entire life to suddenly needing to prop yourself up, that is not a comfort preference. That is a symptom. Now consider the full picture. If this shortness of breath appears alongside the exhaustion from earlier, the chest pressure or the referred pain in your jaw or arm, these are no longer isolated complaints. Your body is escalating its warnings. Each new signal added to the pattern increases the likelihood that a cardiac event is approaching. The 5th warning sign is a cluster. 3 symptoms that tend to arrive together, and together they are almost always mistaken for something else entirely. You break into a cold sweat for no reason. Not the warm flush of exertion or a hot room, a cold, clammy dampness on your skin, the kind that feels wrong the moment you notice it. At the same time, a wave of nausea rolls through your stomach. You may feel like you are about to vomit. And underneath it all, a sense of lightheadedness, as if the room is tilting or you might faint. Most people reach for the obvious explanation. Stomach flu, food poisoning, something I ate. They wait it out, expecting it to pass like a bad meal. Here is what is actually happening inside you. When your heart is under severe stress, your autonomic nervous system, the body's automatic emergency control center, flips into crisis mode. It triggers the fight-or-flight response. Adrenaline surges into your blood. Blood vessels in your skin constrict sharply, redirecting blood away from the surface and toward your vital organs. That is the cold, clammy feeling. Your digestive system shuts down completely because the body considers it non-essential during an emergency. That is the nausea. And as the heart struggles to maintain output, blood pressure can drop, producing dizziness and that sensation that you might black out. The distinction matters. Flu symptoms build slowly over a day. You feel a little off, then worse, then sick. These cardiac symptoms tend to hit in waves, sudden and intense, then easing, then slamming back. That wave pattern is characteristic. If cold sweats and nausea arrive alongside chest pressure, jaw pain, or the crushing fatigue we covered earlier, that is not a virus. That is your cardiovascular system telling you it is running out of time. The 6th warning sign is the one that sounds like it does not belong in a medical video, but it has some of the strongest clinical documentation of any symptom on this list. Patients who survived heart attacks report again and again that in the hours before the event, they were hit by an overwhelming feeling that something was terribly wrong. Not worry, not stress about work or money, a deep visceral sense of impending doom that arrived from nowhere and had no identifiable cause. Many of them describe it the same way. I just knew something bad was about to happen. I could not explain it. I just felt it. This is not a psychological quirk. This is not anxiety playing tricks. This is your nervous system doing exactly what it was designed to do. When your heart is critically compromised, it sends distress signals through the vagus nerve and the autonomic nervous system directly to the brain. These signals arrive before conscious symptoms become severe. Your brain receives the message that something life-threatening is unfolding inside your body, but it has no chest pain to point to yet, no breathlessness to explain it. So it translates that raw danger signal into the only language it has available: dread, panic, a certainty that something is wrong, even though you cannot say what. What makes this warning sign especially important is its timing. In many cases, this sense of doom appears before the other symptoms become obvious. It can be the very first signal in the 48-hour window, hours before chest pressure or fatigue arrives. If an overwhelming feeling that something is seriously wrong lands on you out of nowhere, especially if you carry cardiovascular risk factors, do not talk yourself out of it. Your brain is not being dramatic, it is processing information from your heart that your conscious mind has not caught up with yet. Now I want to step back from the warning signs and talk about something equally important: why some hearts reach that 48-hour danger zone in the first place. because those 6 warning signs do not appear out of nowhere. They are the final alarm of a system that has been deteriorating quietly, often for decades. And the forces driving that deterioration are almost always silent. No pain, no obvious symptoms, nothing that sends you to a doctor until the damage is already advanced. The first is chronically high blood pressure. Every time your heart beats against elevated resistance, it stresses and microscopically damages the inner walls of your arteries. Do that for 10 or 15 years, and you have created a landscape of scarred, roughened vessel walls where plaque takes root and grows. The second is insulin resistance and prediabetes. Long before anyone officially diagnoses diabetes, elevated blood sugar is quietly injuring the endothelium, that delicate inner lining of your arteries. The lining loses its smooth, protective surface. It becomes a place where cholesterol, platelets, and inflammatory proteins start to accumulate. The third is smoking. Every cigarette delivers a chemical assault directly to the vessel walls, while simultaneously making your blood thicker and more prone to clotting. Damaged walls plus sticky blood is the exact combination that builds unstable plaques. The fourth is visceral fat, the fat packed around your internal organs. This fat is not just storage, it is metabolically active tissue that pumps inflammatory chemicals into your bloodstream, actively accelerating plaque growth from the inside. And the fifth is a sedentary lifestyle. A heart that is never challenged gradually loses efficiency, circulation weakens, the entire cardiovascular system operates with less and less reserve. Here is what most people get wrong. They believe that normal cholesterol means they are safe. It does not. A person can have textbook cholesterol numbers and still carry dangerously inflamed, unstable plaques that are one rupture away from a heart attack. Cholesterol is one piece of the picture. It is not the whole picture. These risk factors work together, silently, over years. And most people are carrying more than one of them right now, without knowing it. Now the most practical part. You know the 6 warning signs? The question is, what do you actually do if one or more of them shows up in your life? The first rule is simple: do not drive yourself. If you are experiencing chest pressure, sudden breathlessness, or any combination of the symptoms we covered, getting behind the wheel is dangerous. The risk of losing consciousness while driving is real, and it puts you and everyone on the road at risk. Call emergency services, or have someone near you drive. Talk to your family about this now, before anything happens, so the plan is already in place. The second rule: if chest symptoms are present and you are not allergic to aspirin, chewing a regular aspirin, not swallowing it whole, can begin to thin the blood and slow clot formation at the site of a rupture. Chewing matters because it gets the drug into your bloodstream faster, but this is not a treatment. This is a bridge until medical teams take over. Discuss this protocol with your doctor in advance so you know whether it applies to you before you ever need it. The third rule is the one people violate most often: do not wait. Do not sit on the couch hoping the symptoms pass. Do not convince yourself it is indigestion because you just had dinner. The difference between acting in the first hour of a heart attack and acting in the 6th hour is often the difference between a full recovery and permanent damage to the heart muscle. Time is tissue. Every minute you wait, more of it dies. And here is a clear line to remember. If even 2 of the 6 warning signs from this video appear together within a short time frame, treat it as a cardiac emergency. Do not negotiate with yourself. Do not poll your family for opinions. Act. One more thing. Do not take someone else's medication. Do not try to walk it off. Do not assume you are too young or too healthy for this to be happening. Heart attacks do not check your assumptions before they arrive. If you have risk factors, high blood pressure, elevated blood sugar, a history of smoking, a sedentary routine, and you have never been screened, do not wait for warning signs to appear. Talk to your doctor now about a baseline cardiac evaluation. Blood pressure, blood sugar, a lipid panel, and depending on your risk profile, potentially a stress test or a coronary calcium score. These are the tools that catch the problem while it is still manageable, before it reaches the 48-hour window at all. Let me bring this together. Your body does not go silent before a heart attack. It speaks, clearly, specifically, and usually more than once. You now know the 6 signals it uses: unexplained, bone-deep exhaustion that sleep cannot fix, chest pressure that comes and goes, tightening and releasing like a warning shot, pain in places you would never connect to your heart, your jaw, your shoulder, your arm, your upper back, sudden shortness of breath from effort that never winded you before. Cold sweats, nausea, and lightheadedness arriving together in waves, and an overwhelming, unexplained sense that something is seriously wrong. Any one of these appearing suddenly deserves attention. Two or more appearing together is your body telling you that the 48-hour window is open, and it will not stay open long. The 48-hour window is not a curse. It is a gift. It is your body giving you one last chance to act before permanent damage sets in. Most people never get a warning this clear for anything in their lives. You now know what it looks like, you know what it means, and you know what to do. Do not let this information sit unused. Talk to the people closest to you. Tell them what you learned. Make sure someone around you knows these signs too, because in a crisis, you may not be the one who needs to recognize them. They might need to recognize them in you. And remember, that free cardiac screening link is in the description. 30 seconds could genuinely make a difference. Take care of yourself.